thank you all for being here today. Um, if you are looking to be in the BVIPsych webinar series for the specific learning disabilities presentation, you're in the right place. We are so happy to have Dr. Beth Jones with us today. If you need ASL interpretation or closed captions, those options are available to you on the Zoom bar. Simply go to the interpretation button and select American Sign Language to access those videos. I'm May Wynn, school psychologist for the California School for the Blind Assessment Center and co-coordinator for the BVIPsych group. This is a group from the National Association of School Psychologists. And if you're not a paying member of NASP, we do have a Google group, which we will pop a link in the chat if you want to register for that for free. And we're going to have a series of different free webinars this year. And we are so lucky and happy to have Dr. Beth Jones with us to present on SLD today. We'll put the links for the other events into the chat so you can check it out later. I want to introduce Dr. Beth Jones, who earned her doctorate with a concentration in special education from Louisiana State University. She also holds a master's in educational psychology, and she has experience teaching in public schools and is currently a professor of special education and graduate program coordinator at East Texas A&M University. She is a board member for the Texas School for the Blind and Visually Impaired and recipient of the TAER, Texas Chapter Award for Outstanding Contributor. Her research interests include coordinating with families, visual impairment, and assistive technology. She designs and co-runs an assistive technology lab at East Texas A&M University. And she is heavily involved with research in this area and the training of pre-service teachers in assistive technology. So you might be wondering why she is presenting on visual impairments, since she is not a teacher of students with visual impairments, but we're very lucky to have her. The answer is that because her family, her dad, son, daughter, and herself have a dominant optic nerve atrophy, which has given Beth firsthand lived experience with the needs of individuals with visual impairment and deafblindness. So she hopes to capitalize on her unique position to be a bridge between service providers and families as she lives both roles. And we're really lucky to have her presenting today. So I'll hand it over to Beth.
Thank you so much, May. That was a wonderful introduction, and I'm excited to be here with everybody, and I'm glad that everybody has taken time to dive into this a little bit deeper with us today. The one thing I want to add to May's introduction is that I do have a daughter that has been diagnosed as dyslexic as well, in addition to her visual impairment, and that was a process that was it was the result of myself and my colleagues literally developing a way to test her in my home over a spring break and take that as an IEE to the school, independent evaluation to the school. And it was through that process that I dove into some of the materials that you'll see here today, but also it's just as I prepared for today and I'm looking at those materials and I'm looking at, comparing that to what we did through that process, I feel very proud and, pleased to share that I feel like everything we did in evaluating my daughter and the protocol we used to adapt testing to her really followed a lot of the recommendations that I'm going to share with y'all today. And so, I feel like that personal experience that I had just really, kind of a trend of my personal life, mirrors my professional life in a lot of ways. And I hope that the benefit of, what I've had to, kind of figure out on my own because of my family demands will help other kiddos. So that's why I'm here today and hope that that will help for the context for why, I got into this. I did teach resource in the resource setting when I taught in public school, which when I primarily taught students with learning disabilities. And that was my main focus. That was the main focus of my research, really even up to the tenure mark. I was really, in the LD world, so to speak. And it's been post tenure that I've really kind of moved into the VI world, and am now overlapping those worlds, so that, kind of bridging that gap, because I have found it's a very dire need, for that population of kiddos that truly need specialized services for both disabilities. So I'll let you go ahead and move slides. And I believe the next slide just restates our learning objectives that we had listed on the advertisement for the webinar. But just as a reminder, we're just going to talk about, characteristics of kiddos that are, possibly comorbid VI and LD, and what those impacts might be for learning, and why the dual diagnosis is so important. What are some hindrances to that diagnosis? We'll talk about that. And then but why is it so important that, we truly try to tease out if there is an existence of an LD for these kiddos. We'll talk about RTI or MTSS frameworks that you can use to help you in this process. And I'll show you a couple of tools that they could use to help this. Really, it is a fairly emerging field with regard to evaluating students with VI for SLD. But hopefully some of these tools I'll share will help make that a little bit, clearer path, at least have some direction on where to go with looking at how do we try to intervene with students who already have an existing VI, and we're looking at a possible SLD, and tell whether they're responding to those interventions or not. And then the last thing, we're going to look at some assistive technology. Specifically, I have pictures of my daughter on here. It's just the back of her head. You can't see her face, but and how we use the assistive technology we have in our home to, in the testing process, when my friends here came and tested her in our home, how we use those assistive technology devices for some of those subtests that we're going to talk about. So those are the learning objectives today. And then I believe the next slide will kick us off into the problem. And that's just mainly that a lot of times our kiddos with VI who, could have a LD in coexistence with that, a lot of times that LD piece goes unidentified. And that's just been a problem for quite a while. I think we are seeing progress in students truly getting the correct diagnosis, so that we can better intervene and choose better accommodations, and know a little bit better about how to explain what's going on. So we are seeing progress, but it's still a challenge, and we'll talk about some of those challenges starting on the next slide. So May did have a chance for some of the audience members to put in questions ahead of time, and I built in 2 of them to the slideshow where they fit, and others I believe we'll address as on the panel date in a month. I believe that's coming up. But for today, I'm just going to address the ones that fit into my presentation. And the first one was just a question about, why do school district psychologists refuse, this is not my language, to test a student who is blind for an additional learning disability. This person said, seems like they always want to just emphasize the visual impairment and not go further exploring into an SLD. And they're asking, is it because they don't have appropriate testings for SLD? So if we'll go to the next slide and we'll start talking, we have a couple of reasons why it's a challenge sometimes to get districts or child study teams to pursue an LD label for a kiddo. And the first one is really related to that federal definition of SLD. And we're going to look at that specifically in a minute. But there's an exclusionary clause in the federal definition of IDEA, Individuals with Disabilities Education Act, that specifically lists factors that cannot be the primary cause or the sole cause of a disability. And vision is one of those. A visual disability is one of those. And so in the past, the exclusionary clause has been used, and it still may be used as a way that have prevented districts from looking for that dual diagnosis of VI and LD, thinking, okay, you're VI, so you automatically can't be SLD. But that's really that's really not the way that exclusionary clause was intended. We've gotten some more recent guidance on that, and I'll talk a little bit more about this document. I am in Texas, and so Texas Education Agency put out a document for us in 2022, giving some insight into sensory impairments and the overlap with specific learning disability. And one of the quotes from that document is, a common misconception is that the mere presence of a sensory impairment automatically rules out a specific learning disability. And this is just not true. It's not the case. A sensory impairment can coexist with a specific learning disability, including dyslexia, in part of that definition. So that's one difficulty, is having just administrators, assessment personnel realize that they have the freedom to explore. If they go and they get we're training people to go get a vision and hearing screener before you do any testing, and it's getting people the freedom to understand that even if they've failed their vision screening, but or they're a kiddo with visual impairments who already is in services, if that doesn't preclude them from being an SLD. Now, we wouldn't want to go straight to SLD for someone who failed their vision screening and has had no, help or access for a visual impairment that needed one. You wouldn't want to go straight to SLD. However, if it's a student, I get called every year for my daughter not passing the vision screening. Yes, I know, I'm aware. Here's the name of her doctor, yada, yada, yada. If that's the case, and the vision has already been corrected to the best possible, acuity. In my daughter's case, she had 2 strabismus surgeries. All of that's been done the best it could be, and that's one of the reasons why I did not have her tested until 4th grade, because she had 2 strabismus surgeries that were delayed because of COVID, and I wasn't comfortable diagnosing or labeling her as dyslexic until we could for sure say her eyes were teaming together. And so that's a very important piece, I feel, to the puzzle, is you've ruled out everything possible related to the vision, but there's still something else going on. All right, the next slide talks about another reason for under-identification, and that has to do with the fact that the similarities, academic and behavioral both, between students who are BI and students who are LD, there's a lot of overlap. We see, our students with VI, if I ask our vision teachers on the call, what's one of the most common things you see in students with VI? Trouble with reading, issues with reading, delays in reading and writing. And that could be due to having to use specialized equipment to do these things. And it's in a non-standard way. You're trying to teach a kindergartner or a 1st grader to write under a video magnifier, and that's just not a normal process. And then our students with SLD, the biggest category of students who are served under SLD is it's due to a reading disability. That's the biggest group of kiddos served in that population. So there's a lot of things that could present in the same way that could have different different ideologies, if that makes sense. Both of them could be presenting in the same factors, but it could be due to different reasons, is what I'm trying to say. Students with BI are often below level in reading due to that reason, for that delay it takes them with their technology to learn to read and write, especially if they're still trying to learn the Braille code as a young kiddo, trying to learn to read. And our SLD kids, usually a district in that, historically wouldn't look at a diagnosis for SLD until a kiddo was in 2nd or 3rd grade, and you were seeing, some failure to achieve at a level you would expect. And so because of that, oftentimes the VI is identified first. So we can move on to the next slide. All right, so this just lays out some of those commonalities that I was talking about between academic and behavior for those populations. And you'll see that the list is the same on both sides, right? Our kiddos from both populations can be exhibiting some of the same characteristics. I mentioned the reading, and that may be the most obvious one, but difficulty with spelling. A student with dyslexia is going to have difficulty spelling because they spell phonetically, and they don't have that map from the sound to, the spelling for that. But yet our kiddos with visual impairments are going to have difficulty with spelling because they haven't had visual access to that word in print as many times as everybody else has to learn the spelling. They're often spelling phonetically because they haven't seen the word in print enough. And so they're having some of those same difficulties with spelling. Both populations have difficulty with social skills, loneliness. Some of these social skills aren't just intrinsically picked up on for our kiddos with BI. They can't see a person's facial expressions. They can't see some of the nuances. And same thing with our students with LD. They may have difficulties with social skills that are directly due to their LD, such as, like I said, loneliness or anxiety for both of these populations. And then there's a struggle with independence and isolation that comes with both of these as well. So if you can't, easily get to other students, that independence piece, that's an isolation piece. You can't get to them. You do feel secluded. And the same thing with our students with LD, they might struggle with independence because, they struggle with doing tasks independently, or they struggle with, adults giving them that independence because, they may have behaviors that are attention seeking or task avoidance behaviors that are causing them to present as, troublemakers or whatever it is. Learned helplessness comes into the picture here, where, they'd rather just not try and fail versus really try and fail. It's more socially appropriate. So we see a lot of the same overlaps in the population, and that contributes to the reason why it's so hard to tease out, what's going on. Is there a comorbidity, or is there, truly just one issue going on? But I believe that takes us to the next slide. Yeah. All right, and we'll just briefly talk about the idea definition of VI. And I do this because I realize there's school psychologists on the call. There might be teachers of the visually impaired on the call, and we always don't speak each other's language. Not all the time are we able to speak each other's language. And just for the background, the educational definition of visual impairment includes blindness. So it includes both partial sight and blindness, and it really has to do with, does the child's vision affect their educational performance? Okay, so even with correction, so not if you can get glasses or contacts and you're back to 2020, that would not be considered a visual impairment. But if you're still with the best correction possible, having an acuity issue that's adversely affecting a child's performance, then that child could potentially be eligible for special education under visual impairment. There is no acuity requirement under the law for eligibility in special education. Not all states require a medical report. Some do. In Texas, we require a medical report that talks about, the acuity levels that the doctor gets, but that's not required by all states to be identified as a student with a visual impairment. But the next slide, just to give you an idea of visual acuity, if you're not familiar with working with students with visual impairments, the legal definition of it, for legal blindness is 20/200 or worse. Anything really 20/200 all the way to total blindness would be considered legally blind, where partial sight would be 20/70 to 20/200. So when you think about that, it may be hard for you to comprehend, or even, think about what would it be like to have one of those acuities. And the best way I can explain it is, our normal vision, 20/20 is what we strive for, right? Well, someone with 20/200, what that means is what they can see from 20 feet is what a normally sighted person could see from 200 feet. And that's true for any level of acuity. It compares to what a normally sighted person could see. So the main thing I like to kind of point out here is, when you get that legally blind, definition, that could be misleading as well, because, for example, in my vision, I'm legally blind. I'm right at 2200, and so is my daughter. But yet my son has progressed to 20 over 1600 in his better eye. We're all in that legally blind category. But I say that to illustrate the point of the spectrum and the wide range of visual acuities that you're going to come across, not to mention eye conditions, you know, you know, the ideology behind the eye conditions. There's such a wide range, and a wide range of how it's going to be, presented as mild, moderate, severe eye loss, eye vision loss, or is it, I'm sorry, I lost my train of thought. Basically just is, how does it present, and it presents so differently? And what I was going to say was there's such a low instance, a low prevalence rate of students with visual impairments, that becomes part of the challenge in this piece, in this puzzle with the comorbidity of SLD, is because VI in itself is such a low prevalence, low incidence population that the research on just that population is difficult, where you're looking at having to do a lot of single subject research. There's not just a whole lot on evidence-based instruction for just that population, because it's so specialized that overlap with LD becomes even more challenging. But we'll move on to the next slide. And it just briefly talks about the definition of SLD. And most of you on here are very much aware of the definition of SLD, so I won't spend too much time on this. But what we talk about when we present on this is just kind of, the very broad nature of this definition that's in federal legislation for specific learning disability. And basically it's a very broad, all seems all encompassing, could be a lot of things, definition. But basically the way it's written in the law is it's a disorder in one or more of the basic psychological processes involved in language, either spoken or written, that's going to manifest itself in the way a student, listens, thinks, speaks, read, writes, spell, or do mathematical calculations. The interesting part here is it says in the definition that this includes conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. I feel like that dyslexia piece sometimes wasn't always associated with the SLD definition, but it is there in the actual IDEA definition of SLD. All right, and the next couple of slides just continue on the definition of SLD, and it really just talks about how for a student to qualify as SLD, we're going to be looking for a pattern of strengths and weaknesses. And really this changed with IDEA's reauthorization in 2004. Prior to that, some of you maybe experienced as I am, and remember that back before 2004, we really did a discrepancy model for identifying students with SLD, meaning that you would give them an IQ test, an achievement test, and if there was a 16-point discrepancy in those scores, bing, bang, boom, they qualified SLD, and you went on about your day writing an IEP. But with IDEA 2004, we got a little bit more freedom and permission to do RTI or MTSS, whatever you refer to it as a way to determine if the student is not responding, number one, to specialized instruction and intervention, and if there are a pattern of strengths and weaknesses in their data that you're seeing compared to either their age or state approved standards, that would be commensurate with what we would suspect for identification of a SLD. And the next slide just talks about the second part of that criteria, where they're looking at when a student is provided learning experiences and instructional experiences that we would say are appropriate for grade level, to meet grade level standards, they're not responding, they're not achieving at the level we would expect given that high level instruction. All right, and the next slide goes into what is not a disability, what is not a SLD, and this is where that exclusionary factor in the definition of SLD. This is how it's written in in the legislation, which is why we get that difficulty with people using the exclusionary clause as a reason not to identify, because it specifically says disorders not included, and it lists vision. Well, the key word there is primarily, and that's why I have it denoted in green, because it doesn't mean there can't be a vision problem. It just means that the learning problems aren't primarily due to that vision disability. It was meant as a way to keep students from being mislabeled as as having a learning disability when they truly didn't have one. So the intention is good. What I was speaking about was related to the exclusionary factors portion of the federal definition of specific learning disability. And again, that word primarily is the key word that you really have to pivot around when talking with administrators, talking with the child study team about the presence of a possibility of a presence of a coexisting disability, is that it is okay, to pursue looking at a potential second comorbid disability, even if there's a vision disability as their first disability, or their primary disability. And what I've given you here is a link to an article by Whitaker and Ortiz that specifically addresses what is a specific learning disability, and the exclusionary factors that are related to that. And one of the quotes I pulled from that article just talks about the fact that SLDs can exist with other disabilities, and it gives examples. And the first one is sensory impairments. And so it's not meant to be that. Sorry, it changed on me. There we go. It's not meant to be that, they can't have other factors, and those other factors can be contributing to their learning problems, but they they're not the primary reason. The vision has been addressed to the greatest extent possible. We're doing everything as far as correction and accommodations and technology, and they're still having struggles. So that does not rule out the possibility of an LD. All right, so we can move on to the next slide. All right, so the main point here, and I go back to that guidance document that we got here in Texas in 2022, that really helped clarify things here, boils down to the fact that a visual impairment does not preclude eligibility under SLD. Okay, they can very much have both, and the IEP team should not automatically just dismiss the possibility of an SLD eligibility because there's a prevalence of a VI. And the IEP team really has to look at how much are those exclusionary factors impacting the student's educational performance. Are they due to those exclusionary factors, or are there possible other things that are going on? All right, the next slide, please. All right, so why do we want to identify SLD in the kiddos that are VI? If there is one, why would we want to identify? Well, the first thing is because we want to be able to provide appropriate, emotional and educational accommodations and strategies, right? We know that students, as I mentioned before, with SLD are going to have maybe specific emotional needs. They might have that history of learned helplessness. They might be perceived as lazy if they're not, if they're not formally identified as SLD. That could be misconstrued as lazy and then be at a risk for dropping out. So there could be both emotional and educational benefits to that diagnosis, where a student feels more validated. I know for myself, when I tested my daughter at first, she says I tricked her. I did tell her that she was just helping my colleagues learn how to better test a student with VI. I didn't tell her we were actually looking at her as possibly having a VI until as possibly having an LD, until I knew exactly, what they saw in their evaluation. But after we did kind of really narrow it down to dyslexia and take that to the school, and they accepted the IE. And she said, "Mom, thank you. Thank you. I can now have something to hang it on. Like I understand better why I'm struggling. It helps and I see that a lot with other kids too. They feel like almost a sense of relief that they have some explanation to put with it. So that's important, and it's important, for the educators and the whole team to have a better picture of what's going on with the kid, and be able to really prescribe and work with the family and the kid to accurately, you know, just know the whole picture and be able to come up with accommodations and make recommendations that really address the needs of both the BI and an LD. All right, the next slide, and I'll try to move a little bit quickly through this, but this just gives that I took that same list I had a couple slides back about what are some of the similarities and added on to it, and really tried to highlight why is that comorbid diagnosis so important for our kiddos that have overlapping VI and SLD? And it's really because our kiddos with VI need that skill to be able to prioritize the most important information, be able to, um, you know, retrieve it and be organized, have those skills to be able to just pick out what's the most important, be able to retrieve it, in a timely manner. And that takes organization skills, and it takes a lot of adeptness with technology and learning strategies and being aware of your metacognition and how you learn. And um, like my dad, for example, like when he was in college, he would have readers read him the first and last paragraph of sections of the text because he, number one, didn't have and couldn't pay him to read everything. And that's where he got his most crucial information, because he learned that strategy, you know, got him the crux of what he needed to know from a text. And so they really have to be able to figure out, and be cognizant of how they learn and what's the best strategy for them, and have those organizational skills. And that's where our kiddos with LDs sometimes struggle, is being aware of how they learn and those processes and what works best for them. And they have a can have some negative attributions where they don't always, um, they don't always correlate their struggles with learning with things that they could impact or things that they could change. So that, in combination with the working memory deficits that you might see in students with LD, could really be confounded in a student that already has an existing BI. Um, and then not to mention that our kiddos with VI, the vision could be progressive, as it has been for my son, where it would just make the effects of the LD even more profound. For example, we go to a hotel room and he's packed, a phone charger and all these things. Well, it's easy to miss, when you're going to collect all your things, if you don't have a good memory and organization skills of where you put certain items, it's easy to then miss that. So having a visual impairment oftentimes necessitates good organizational skills. And when that's not your strength, you do need some strategies for improving that. And keyboarding and explicit computer skills instruction is going to be helpful for efficiency for both situations. Whether it's text to speech, or predictive text or something like that, could be useful to students under both diagnoses. All right, the next slide, please. All right, so we talked about what are some of the struggles with identification, but why it's important to get past that and look at if a student truly does have a comorbid SLD BI. But how do we correctly identify students when we know we need to do it? How do we do that? And we'll move on to the next slide. All right, I think probably everybody on here is familiar with RTI or MTSS as being a process where we look at if a student is getting high quality instruction at level 1, and moving on, they're not responding to that basic tier that everybody gets of, evidence-based high quality instruction. They're moving on to tier 2 and then on to tier 3. If those if that level 1 is not, being effective for them, if they're not responding in a way commensurate to what their peers are doing, we move them to more targeted interventions with, maybe an increase in intensity, or, a frequency, for levels 2 and 3. And when we're not seeing students respond between tiers, that's when they move on to the next tier. And you know, hopefully the intention is that the student would respond before needing to go to a special education referral. But sometimes, a special education referral is necessary. And that would be kind of the last piece of this RTI process. And so I think everybody's familiar with that, but I want to go to the next slide where I talk about RTI or the MTSS process specifically related to students with visual impairments. And most people are probably, like I said, very familiar with RTI and understanding what needs to be part of that. But just as a refresher, if it's been a minute, the four main facets of the RTI process are universal screening, multi-tiered systems of support, evidence-based instruction, and progress monitoring. And I share a link to an article that's cited here that I wrote back in 2015, really before I was even very much into the BI world. I look back at it and I'm pleasantly pleased that what I wrote, I do still believe is very accurate. And I think it was good. But really came at it, I guess, more from the LD world at the time and used what little research I could find out there about RTI with students with VI and tried to expand that to give us something more to go on. And some of the major considerations that I put in that article have to do with, okay, well, we know these are the four main components, but how is that possibly different for a kiddo with VI? So universal screening, oftentimes that's done with standardized tests. And as we'll talk about as we go on to the presentation, that's not always appropriate for our kiddos with VI because they're often not normed on that population. And so comparing results on those tests to those of results of cited peers is not always appropriate. So there's a caution with that. When we place a student on RTI, there could be a tendency to want to go straight to tier 2 because of the VI. We'll send them straight to tier 2. But that's, I think we need to guard against that because we're not going to tier 2 because of the vision. We're putting them on RTI because they're having problems in addition to the vision being corrected for as much as possible. So they need to go through the RTI process like any other student where they would, start at tier 1, make sure everything is good there, and then move through the tiers as everyone else. You wouldn't just automatically skip to tier 2 for these students. But as part of that tier 1 instruction, that evidence-based instruction, are our students getting access? Are they getting the expanded core curriculum instruction that they need that goes along with the core curriculum, to help them with their assistive technology or their access needs, and those other skills that go along, self-determinations, sensory efficiency, that kind of things. Are they getting those types of instruction from a teacher of students with visual impairments? And then for progress monitoring, we have to conduct our specific VI assessments as part of progress monitoring. So that functional vision evaluation and learning media assessment that has to be done as part of a full individual evaluation, we need to keep making sure that that's current as we go through our progress monitoring of the tiers of RTI, because if there's a change in the vision, that could greatly impact, the way a student's responding to intervention. If they've had a very sudden progression in their vision loss or something has come up, their medium needs to change. They're in the middle of now trying to learn Braille. All of that comes into the picture about, how they're responding and how we're progress monitoring. All right. The next slide, please. All right. So some factors to consider when you have a student in RTI would be considering whether the student is experiencing significant educational needs despite that access, like I talked about. So they're getting access through accommodations for the vision loss, but we're still seeing struggles that can't be explained. Consider whether the student was provided appropriate educational experiences. Again, that ECC piece. Are teachers taking into consideration the impact of incidental learning, the understanding that they're not just going to look up and see that trees have individual leaves, or they're not going to look up and see the clock in the room, or the alphabet that the kindergarten teacher has posted above the chalkboard or the dry erase board. They're not just going to see those things or learn just because they saw some visual stimuli. They may be missing content just because they didn't visually see it, not because they're not capable of understanding it. And it's also important to tease out if a student, you know, is having difficulty learning the Braille code due to other factors that aren't necessarily a learning disability. Are they having difficulty with Braille code because there's a limited frequency of Braille sessions, or they're not, they're not practicing Braille outside of the VI sessions that they're getting, or, with a qualified instructor. So are there other things that are going on to cause that difficulty with picking up the Braille code that wouldn't necessarily mean it's a learning disability? I don't think, I think it's possible to have difficulty, have that indicate a learning disability, but it doesn't necessarily have to mean that. All right, and throughout this presentation, I've linked a document that's named APH guidance document, and that's something May and her friend Dr. Jen Engel put together for APH. And it's organized by topics, and I've tried to link on the slides when I'm talking about a topic that's specifically addressed in that document. I think you'll find that document very helpful and provides a lot of guidance. But please take the time to go open that and see how the topics correlate to what I'm talking about here. And you'll see that throughout the presentation. So we can go on to the next slide, please. And I'm sorry, I'm having to tell them when to change slides because of my magnification issues. May is needing to run this. So May, would you switch it to the next slide, please? There. All right, so tools to facilitate RTI or MTSS. All right, so I have really two tools I want to highlight here, one of which I did not come up with, and one of which I did. So the first one is the Riot or the iCell model, and I believe there's some examples on the next two slides of that model. And that is, again, something that is highlighted in that APH document under topic 2. Is pertinent to that. And there's examples in that document as well. And actually the next slide gives that example that's presented there. But basically what it's letting you do is having a way to just organize the data on a student to be able to answer questions and how to put it out and just kind of look at what you have basically on what do we know about this, the student, from a review of records, from interviewing the student, from observing the student. And that's all done before we test a student. And we're looking at instruction. We're looking at the curriculum that they're being exposed to, the environment that they're in. And then what do we know about the learner themselves? Okay, and so this example that's given in the APH document, it's over a fictional student, Rick, but it helps give a guide to what the teacher or the assessment person would be collecting in that phase of data collection to help create the whole picture of what's going on with Rick. Okay, so I'll let you peruse that more on your own time. The link in the PowerPoint will take you to that. There's a specific kind of answer document related to Riot and iCell. I don't know if you're clicking on that directly. It will take you to a specific document on how to use this to gather data and organize the data as you look at it to kind of, look at the puzzle of what's going on with the kiddo. But we don't have to specifically look at that now. That is published on Intervention Central. We can go on to the next slide. And this is an example, as I mentioned, the article I did back in 2015 related to using RTI with students who are VI to possibly look at LD as a diagnosis. And as part of that article, I created a checklist of sorts that can be used by our child study teams to help them through the RTI process with a kiddo with vision needs. And that's in that article. What you see here highlighted are things that I've added to the checklist since that publication. And the reason they're added is because I did a follow-up study where I sent out my checklist to vision professionals all over the state and to administrators all over the state to get their perceived or their perceptions, their perceived relevance, their perceived, just expectations about how they felt like this would work. What is their perceived, you know, reliability of this form, and what you see added here in the highlights are things that came out of that study as what people recommended to be added to this form. And one of the simplest ones was they just wanted a way to add demographic data about the student at the top of the form. And so that's what's highlighted at the very top of the form is just basic data about the student: age, sex, gender, basic information about that kiddo. But then you'll see I have it organized by preliminary questions that you're going to want to ask and make sure are addressed before you ever even start the RTI process or MTSS process with a student that's VI. Okay, what are those factors that really have to be considered before we can even say we're ready to move on through RTI? And some of those would be, is a vision teacher involved on the team? Is there an orientation and mobility specialist on the team? Has a functional vision evaluation and learning media assessment been done? What are these things that are absolute must, do not pass go, do not collect $200 kind of thing. You do not go on until those are done. And so those are the things that are listed under the preliminary questions on this form that I came up with. And then you start seeing that it goes through the different levels of RTI and the questions that you could ask to just verify that this is happening for a kiddo before you move on up to the next tier. And on the right side of the form, you will see I have just kind of a mock write-up of how this could be used for a kiddo to document what's been done and where they're going with this kiddo. But between every tier on this form, so for those of you potentially having accessibility issues with this form, basically it just gives a section for preliminary questions, a section for each level 1, 2, and 3 of RTI, and at each level what questions should be asked and make sure that they're being addressed before we move on. But between each level, we're doing coming back to a check related to the LMA and the functional vision, and making sure there's no change, there's no needed change in assistive technology between each of these tiers. Because if there has been a change, then that could indicate that potentially a change in vision is causing some of the learning problems once again, where it had not been in the past. So that's why it's important we check that at every level. But some of the questions you're wanting to ask is, are they getting that evidence-based instruction from the general curriculum, but also a teacher of the visually impaired consulting with the general ed teacher to ensure access. All of those accommodations are being met so that they have the access to what everybody else is getting access to, and in a timely manner. And then on to are there specialists on campus involved in their tiered instruction to make it more specialized? And then, when you get down to tier 3 and tier 4, especially we're looking at tier 4, when we go to special ed referral, what are we doing to guard against threats to the validity of and reliability of our test results? How are we making sure there's external and internal consistency and construct validity and all of these things, ecological validity? How are we making sure that we're guarding against those threats and doing the best we can to use all sources of data to come up with a comprehensive picture of the kiddo? All right, so that's outlined. There's actual example of that checklist in the article, but like I said, the things and highlights are not included in that version. They have been added since, and that is hopefully going to be in press soon. But I wanted to give you a kind of a sneak peek as to what we added to the checklist based on professionals' feedback. And I will move on to the next slide because I think we have about 30 minutes. So I'm going to try to move quickly so I get through everything as comprehensively as possible. All right. One of the things I want you to take away today is that to effectively assess a kiddo with VI for SLD, there has to be a collaborative effort, especially between the teacher of students with visual impairments and the assessment personnel. The 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 two people that did my daughter's evaluation, they would very much tell you they would not feel comfortable doing it alone. Number one, the assessment personnel will more than likely tell you that they have not tested many kiddos with visual impairments. They don't have a lot of experience doing that. And also, they need each other to think through what adaptations are going to need to be necessary beforehand, but also be able to take thorough notes and make adjustments on the fly during the testing situation. And remember what they altered when they go to write up the report after the fact. You know, how did we do it differently? Why can't we not report a score on that because we didn't, it was a time test, or what was going on, or what font size was the student using to access this, or what medium, what assistive technology, all those incidental notes that are so important to a really thorough report being written on a kiddo. It really takes two people. So I just want to emphasize throughout my talk today the importance of the specialized personnel coming together to really do the most comprehensive job possible in evaluating a kiddo, and it not being an issue of turf or this is my kid or your kid. It's our kid, and we're trying to do the best thing possible and get the best picture of a kiddo and really make sure we're doing no harm. And I know that you hear that in medicine, the Hippocratic Oath, do no harm, but it's easy to do with a kiddo with VI is misrepresent their intelligence, and we want to be very careful that we're not doing that. We want to make as accurate of statements as possible, and to do that sometimes we need to lean on each other. So I'll move on to the next slide, and it's nothing really we have to look at today. It's more for your perusal later, but I just want to point out that I got this first part from the School for the Blind. It gives specific roles and responsibilities for the teacher of students with visual impairments. And there's a coffee hour that was done by the School for the Blind specifically related to the role of the vision teacher. Because a lot of times our gen ed teachers, our assessment personnel haven't really worked closely with the teachers of visually impaired. They don't even really understand their job or what they do. Or, as I mentioned, the low prevalence of this disability may mean they've had one student their whole career that has had a vision impairment. And so oftentimes they don't have that working knowledge of what a teacher of the students with visually impaired would do or what their role should be. And so this is just a little bit of background on that, but I also want to give those people the background on what a school psychologist or an educational diagnostician would do. In Texas, educational diagnosticians are a thing. I know they're not in all states, but in Texas, they are used to do a lot of the assessments and could be pulled in on that SLD evaluation. And so I wanted to include both sets of professionals in this conversation about what are the roles, what are the standards, what are the competencies these individuals are supposed to bring to the table, and how can we work together. So you can peruse those resources at your own leisure, but we'll move on to the next slide, and I'll specifically highlight what I want to point out related to roles and responsibilities. And then that's that no matter who you're looking at, whether it's the teacher of the visually impaired or the assessment personnel, you'll see common themes related to, expectations for collaboration, but also expectations for assessment, but specifically related to TSVIs. Their main job is to help the whole team, including the family, understand the kiddo's eye condition and what the impacts of that are, and what unique educational needs that presents because of the visual impairment. And that's one of their main jobs, is to help them understand what that means and what this is going to need to look like for this kiddo. But also right there in the roles and responsibilities for the VI teacher, it talks about helping with initial and ongoing assessment and evaluation, meaning consulting with the assessment team, okay, to talk about what accommodations or modifications are needed, assisting with assessments when they're needed, and interpreting assessment results. So it's very much in the TVI's job description that they're to be involved in that process. And so that's a reasonable expectation. That will take planning, and we'll talk about that a little bit later as to, this potentially could take longer to test a kiddo with VI because of the planning that needs to go on and the scheduling of having two professionals there during the assessment process. But I think you'll find it very much worth the time and planning that goes into it. All right, next slide, please. All right, so things to consider, and it was funny because I looked back at the slide and I had May cited there, and I had no idea who she was until this opportunity was presented. So I'm so glad to get to meet May in person. I had been citing her, so I'm glad to meet her face to face. But basically, things from this document that May put together are things about how we need to collaborate, what we're getting guidance on from each other. Okay, so the vision teacher needs to collaborate with the evaluation staff throughout the process, from planning and the observations and interviews we talked about during that RTI process, to that administration of tests and the scoring and interpreting the results and rewriting that report. The vision teacher needs to be right there alongside our assessment personnel through the whole process, providing guidance on, what can the student access visually? What is the functional vision like? How do they appropriately adapt activities and an environment to give them access? What is the student's learning media? Are they a print reader? What is the font size that's recommended? Are they a braille reader? Do they require assistive technology to be able to access print? Um, um, what impact is the VI going to have on their testing performance? All of these things could be a consultation between the vision teacher and the assessment staff. Okay. Sizing, positioning, lighting requirements, the fatigue a student with a VI may go through during testing, contrast needs. All of these things are items that a TBI or TSVI would need to work on ahead of time with that assessment person to help make sure that they're picking the best testing conditions for that student with VI. Is there a time of day that's better due to their visual fatigue? Are there any other behaviors that are presented? Okay. All right, we'll go to the next slide, please. All right. The next portion really just, I want to give you permission to use professional judgment. And it's really not even me giving that permission. I want you to look at how the testing manuals are even written and the documents that are written support the use of professional judgment. And it's I feel like so contrary to how we train assessment personnel at my university. I'm in charge of a program that trains educational diagnosticians, and I feel like we do a whole lot of you have to follow protocol, no variance from protocol, scores are the end all be all. And while that's good and helpful, and we want them to follow standardized procedures, that also has a message of you can't veer off from anything. And sometimes our assessment personnel don't feel that they have the right or the ability to adapt or even pull subtests from different measures to get what they need and then only report what they can report. They don't have to report a full scale, or they don't have to report scores on measures that were timed. And that's okay. And we'll go to the next slide where it literally is a quote from the WISC manual from Wessler himself, where he's talking about the fact that you have to have that professional judgment enter into the picture when you're trying to get a good idea of what's going on with the kiddo. So if we'll switch to the next slide, I'll share that quote with you, and then we'll look at one on a document related to the WJ. But Whistler himself says professionals who assess a child's functioning should rely on clinical judgment to evaluate the effects of modified procedures on test scores, despite the fact that some modifications do invalidate the use of norms. Such testing of limits often provides valuable qualitative and quantitative information about the child's strengths and weaknesses. So even though we might not be able to report a score, are we still going to be able to get valuable information to help us determine patterns of strengths and weaknesses in this kiddo? All right, and the next slide is a quote from a document related to using and adapting the Woodcock-Johnson 5 for students with sensory impairments. And I've linked that in a hyperlink here. But basically, the quote from this guidance document says, often, just as with people with normal hearing and vision, the most important information does not come from just the scores alone, but from qualitative analysis of those scores, an examination of the examinee's responses within and across tests to find those specific strengths and difficulties. All right, next slide. Okay, another question we got from the audience ahead of time was someone asked, are there preferred assessments for psychological and academic evaluations to use for BVI students and or recommended accommodations? And yes, there are tests that are recommended, and there's a document here that is hyperlinked that talks about tests that are available in large print or Braille. But in that same document, it talks about different tests as they relate to the G's of the CHC theory. And so I hope that's helpful to you. Again, it's important to remember that subtests can be informative, even if you're not reporting the whole thing. So you could look at specific subtests and which ones are going to require accommodations and which ones aren't. I think you'll find some aren't going to require any accommodations. Those that are auditory in nature may not require any accommodation and could be reported as normal. Like, for example, I've listed here the digit span subtest. That was one that was done on my daughter. When they tested her, they did the WISC and the CTOP and the GORT and the Wyatt, did subtests of each of those. And the digit span, for example, you're just repeating back those digits to the examiner, and that doesn't take any accommodation. But for some of the tests, there will be accommodations necessary, such as I mentioned before, the lighting. Every kiddo with a visual impairment, again, is going to be different. You need to ask them what works for them. Do they like a lot of light? Do they like it dark? You know, is there a time of day that they're less fatigued, that their eyes are less strained? How long can they generally work without needing to take a break for their eye fatigue? The assistive technology that they're going to use to access the test. I know a lot of our tests now are on iPad, but you'll see with some pictures I'll show in just a minute, we put the iPad under my daughter's technology and she took the test that way. Are they going to need to test over several days? And then I've linked a document I created related to color contrast to try to show some examples and non-examples of good color contrast. And this is here for your perusal as well. And again, it's so student specific that you really need to ask the kiddo what color contrasts are best for them. But you'll see here, I've tried to come up with some generally known examples. For example, yellow on blue and blue on yellow are known to be good contrast for students with visual impairments. And you'll see that on a lot of the technology that's out there, as well as white on black or black on white, having a very sharp high contrast in the color of the print versus the color of the background. When the background and the print become more similar in colors, it's almost like the words disappear off the screen or off the board or whatever you're looking at. And so then it becomes an issue of not even being able to see the content, much less be able to do a skill or a task related to the content. But just simply changing the contrast of how that's presented could make it a whole lot more accessible for a kiddo, asking them what they prefer as a color contrast. And that, I think, is a special consideration with testing, because some of those tests are, visual and require looking at different colors, like maybe the block design test would be something you need to think about, the color contrast of how a kiddo prefers to do things. I know my son on the computer uses the inverted color. So if you alt control I, it changes your invert color to where you're looking at a black screen with white words. And that's his preferred mode. And so that would be something the examiner needs to know when they're testing. All right, we can pop back out of that. All right, next slide, please. All right, and I just wanted to share some additional things to consider before testing, and this is straight from guidance documents, okay? So prior to testing, this is straight from the WISC. Prior to testing a child with sensory disabilities, the examiner should become familiar with the child's, circumstances, their preferred mode of communication, What might necessitate a deviation from standard procedure? They need to think about that ahead of time. You're not just going to walk in and test this kid like you would another kid. Okay, you're not going to follow the standard procedures. You have to think about what tests are going to be appropriate, what you're trying to get from each test. Like, what's the purpose in giving this test? We're not just giving it to give it. What are we trying to get at? How is that going to inform the picture? And what all modifications from standard administration and scoring would need to be, and that they need to be documented as to what was done, and that has to be considered when you're interpreting test results as well. Okay, so that's just kind of like the, you know, prerequisite of knowing you're testing a kid with a sensory impairment. Is kind of doing your homework on what's going to be necessary, how to even select a test, and that's a section on that APH document as well, how to select appropriate tests, and then how we're going to report the scores that we can get and the information that we can get. All right. And then the next slide talks about guidance on what has to be done for the WJ. The WJ5 is out. We're still waiting on the Braille edition of that. But we know we have guidance on the WJ4 that says an examiner the team must include a qualified examiner who is competent in administering the WJ to sighted individuals and an auxiliary examiner. So here they're saying absolutely there needs to be both the primary examiner and auxiliary examiner, and you'll see that modeled in some of the pictures I'm going to show you of how they tested my daughter. But that auxiliary examiner would need to be that teacher visually impaired that's competent in Braille, if that's the student's medium, or Nemeth, that's the math code, or the impacts of visual impairment on the development and functioning of the kiddo. Okay, and the examiner should have, they recommend here that had completed at least 2 practiced administrations on individuals who are blind before they do actual testing on another kiddo. And of course, that's best case real world scenario. That's not always possible, but it is very pertinent to have done this and have some experience doing it before we just haul off and gung ho go at it. Okay, so the next slide goes a little bit past what are some of those prerequisites to consider when thinking about testing, and to familiarity with assistive technology that can be used during testing based on what a student uses on a daily basis. So the next couple of slides show actually examples of assistive technology and examples of how that assistive technology is used or was used during the testing situation for my daughter. So the first slide just shows two different kinds of video magnifiers. And if you're not familiar with students with visual impairments, you may not have ever used this technology or seen a student use it. So you need to familiarize yourself with it as well. So if you'll switch to the next slide, it has 2 video magnifiers, both of which are in my home, one of which is a Topaz, and one of which is an Onyx. You'll see when they switch to the next slide that one of them has a tray. The one on the left has a tray that a student would put their document they're trying to read on, and it would project to the screen in a magnified way. Again, the student can adjust the size of the magnification, the color contrast. Oftentimes there's a line marker that can be used to try to keep their place. Because what's happening when a student magnifies their document to this level, they're maybe seeing 3 words at a time on the screen. So it's very easy to lose their place. And so that line marker can be very helpful. And again, goes back to that difficulty with learning to read this way. It's a hard way to learn because you're not seeing the whole picture at once as students with normal sight would be doing. On the right, you're seeing a picture of an Onyx machine, and the Onyx machine doesn't have a tray. You just put the documents that the student is looking at under that document camera you see there with an arm coming off the machine. And the thing that's neat about this machine, number one, it's more portable. So my son, for example, uses it when we travel to different events where he has to compete in educational contests. He takes it with him because it's portable, but it's also has a distance camera. So that camera can flip and it can look at what's directly under it, as you see there with that mess of papers, or it can flip and look out at the board where the teacher is showing something, so at a distance. So it gives the learner that capability of doing both views from one machine. So those are some examples of video magnifiers that a student may be using on a daily basis and need to use during the testing situation. The next slide shows some more handheld devices that a student potentially with you know, a less severe visual impairment may be using. My daughter, for example, sometimes uses a handheld Ruby. That's a very portable device you're seeing here on the left, where it's good for going and reading a menu or something, a very quick reference. I wouldn't think it would generally be used for a lot of intensive reading just because it is laborsome, but it depends on the kid. And again, that's going into that LMA and see what the recommendations are and talking to the kid about what they prefer and what they use on a daily basis. And we want to test in the way that they're used to operating. All right, so the next slide actually shows some of this technology being used to do some of the test batteries. And so you'll see that's actually the back of my daughter in the middle. And on the left is the educational diagnostician here in Texas who tested her. And on the right is a teacher of students with visual impairments, and they team tested her through this whole process. But this is an example of how they had her do the block design subtest underneath her video magnifier, the Onyx she was using, and how she put them where she could see the blocks under the magnification it needed to be able to create the designs. And the next slide shows, and you can see the color contrast there, the red on white, and why that would be important to consider as well for for students. But this slide shows her doing some of the matrix reasoning task, and you can see the iPad in the screen on this one. The iPad is underneath the Onyx and it's being projected to the screen. But you do need to consider glare issues that might occur when projecting off the iPad, so make sure and check for glare ahead of time. And you see on the right side that the instructor is having to point on the iPad to exactly, or the examiner is having to test, or having to point to exactly where on the page that she needs to direct her attention to for this matrix reasoning task. But both of which are being projected to the CCTV or the video magnifier for her to be able to access that. Because you think, well, why can't you just zoom on the iPad? Well, those test protocols are locked down where you can't zoom on the iPad. So even though iPads are made to be more accessible with zooming, that feature does not work when you're in the testing mode, from my understanding. So that's why the student's technology really comes into play with being able to access those tests in a visual way. Okay. All right. The next slide, please. And we have about 7 minutes, so I'm going to try to wrap it up. But as I mentioned at the very beginning, this was a process I embarked on for a very personal reason, because I needed to get my daughter some help. We weren't seeing the progress in reading that we, again, felt would be commensurate to the level of instruction she had had. My mom's a retired teacher. She had been giving very specialized tutoring and instruction with her. For really all of her, childhood, and wasn't responding. And despite repeated instruction, she would miss some of the little words that you're like, that's and or the. Why are you still missing that? And so to try to get those answers, this really became a very personal thing for me and my colleagues. And like I said, they'll tell you, I've never tested a kiddo with VI. I was nervous as all get out, but it was them being able to come together and do this in a team approach, and think through what needed to happen before testing, during testing, and after testing, as a way of making sure that we're doing everything right to not underestimate a kiddo's ability. So this Canva handout is really the crux of what I want you to look at. This Canva handout, and then we'll look at the document that's kind of made to advocate for students' needs. We'll look at that and then we'll wrap up for today. But if you can quickly click into the Canva handout, I just want people to see some considerations that need to be made to help you kind of think outside the box when you're testing, and what needs to be considered before, during, and after testing. Um, you know, Braille, I know some of the test kits, some of the protocols say don't take or you have to take the pages out of the book to be able to test it. Well, taking pages out of the book for Braille learners is going to, help mess them up. They're not gonna be able to find their place. And so just practical things like that someone who's fluent in Braille would be able to tell you, you can't do that with Braille. They need, sticky on the back of the page to keep it stationary so it doesn't move for them. If you can click into that Canva handout, I just want to make sure that people think about what needs to be considered before, as far as um, making those preparations to do the test administration together and scheduling that, what needs to be done during testing, and knowing that you have permission to, take breaks, test over multiple days, switch technologies from task to task if that's what the student needs. And then after testing, having the ability to um, the freedom to not report a full scale. Why do we need a full scale? It's okay. We don't have to have a full scale for special ed eligibility under SLD. And on my daughters, we didn't report a full scale. We just saw patterns consistent with what you would see with dyslexia, a very high listening comprehension and a reading fluency level that was um, not commensurate with that. All right, so if we can switch, there's one other document I wanted to show. So there's the Canva handout. So please look at that on your own for guidance for the different phases of testing. And then this one, the redacted fact sheet, is actually a document, if you can pull it up, that I created for my daughter, for my daughter's teachers at the beginning of the year. As some parents do, I have a meeting with her teachers at the beginning of every year to go over needs, and the name has been changed. It's been redacted. No last name is on here. This is a pseudonym. This is not my daughter's name. But this is a document I created to give to the teachers as a handout to go along with the IEP, which I know they're supposed to get by law, but also to kind of give them a snapshot page. I think it's very important that we present our kiddos from a strengths-based model to all of their teachers, convey that we have high expectations for our kiddo, and just really set them up for that success from the very beginning with their new teachers every year. I started with this document with explaining the eye condition and what that means. But then I went into what does this mean for the classroom? And you'll see some of the things I talk about there are, it taking, if you'll scroll down a little bit, it takes a little bit longer for her to do visual tasks, for her eyes to adjust from going inside to outside. Her spelling is impacted. If you'll scroll down, I'm sorry, I'm not seeing the whole thing. Maybe everybody else is. It talks about considerations for her specials classes, such as PE and art. If instruction's being modeled, that she's going to have to be really close to that. She's not going to see what you're telling her to do when you say do it like this. And then specific accommodations that need to be considered, such as, making sure she's seated in a place in the classroom that's appropriate, that's near a plug for her technology. All of these things that need to be considered, having that eye adjustment time, breaks for eye fatigue, things of that nature. But the comorbidity of the dyslexia with the eye condition, she's gonna need to use Learning Ally. We need to preload those books on her device so she has access to the material at the same time as everybody else. And then just ending it with some resources. I did hyperlink the color contrast document I just showed you to help explain to the teachers. You can't grade in pink highlighter, and she's not gonna be able to know what you've given her as feedback. If you do instruction on the board with a light color pen is about the same as not having written anything up there. So trying to give them some concrete examples of that color contrast like I provided you, and then just contact information and just information that would be related to the dyslexia, like she was doing the Take Flight and where she was in that program. So this was just a one-page handout, and I hope that's helpful to some of you as something to give to that general ed teacher who, number one, probably hasn't had many students with visual impairments, but certainly hasn't very likely had one with a comorbid SLD, and how to give them that guidance on how to not have to spend the first 6 weeks of school trying to even figure out what's going on, and hopefully we can hit the ground running. So that's what that is, and we can pop back into the main PowerPoint. But I think that's really the crux of what I wanted to share today, and I know we're right at time for the webinar today. But I hope some of these resources can be helpful to you. Hope you found something in it that you can take and apply. But just, that team approach, not being afraid to really, bring your experience and your, you know, uh, decision making into the process and it not being all about what spits out in the output on a test result as to helping us make our decisions, but it really is an informed decision based on all of the information. So again, I hope it was helpful today and thank you for taking the time to join us. I do apologize again for any technical difficulties that were happening. Thank you for sticking with us and we look forward to seeing you back for the panel to dive into this a little bit more in about a month. So thank you so much for having me today. Really appreciate it.
Thank you so much, Beth. This has been wonderful. I don't know if you can see the comments in the chat, but people are saying this is one of the best webinars I've gone to. Thanks. We need more of these. Thank you so much. This is great information, and I sincerely appreciate all the guidance and insight. Thank you. Better than some that give us continuing education credits. So people are really enjoying this.